everybody. A very warm welcome to FSC Connect and through the middle of May as we all head into autumn and chillier weather approaching. Hope everyone has been doing well. It's been a pretty interesting few weeks. The FSC has been on a little bit of a hiatus, hibernation on our FSC Connect program as we headed off into school holidays. We're all well and truly back. So it's great to be back in this forum and this format, but also good to know that we've got a range of programs coming up that are actually both face-to-face as well as digital. And we'll be looking to bring you the best of and the most interesting speakers and content around. Today's session is very much in that world, if you will, looking at the topic of enabling health through data and digital, and an initiative of our health community. And it's an amazing lineup of speakers that we've got to join us today. But the FSC Connect platform is very much around bringing the FSC community together to learn, to lead, to connect, and to hear some of the most inspirational and challenging and knowledgeable speakers on the topic du jour. So today's session is no different, and absolutely delighted to welcome Dr. Stephen Child, Reza, Jarral, Karen Blake, and Will Reedy to the program. They'll be introducing themselves. I'm about to hand over the entire program to Dr. Stephen Child, but just wanted to acknowledge everyone online. Thank you for joining. Everyone who's speaking, thank you for sharing your expertise. And for the next 45 to 50 minutes, we're in your very capable hands as we dig deep into this topic, which I think is particularly relevant given the fairly challenging couple of years we've all come out of, having to manage our own health with experts and expertise from around the marketplace, sometimes not able to see our medicos. So that's part of today's discussion, not all of it. But without further ado, a very warm welcome to Dr. Stephen Child and his expert panel, and leave you in their capable hands. Stephen, over to you.
Well, thank you, Richard. So as Richard mentioned, my name is Dr. Stephen Child. I'm a general physician at Auckland District Health Board. I still work 0.5 from Canada originally. That's the strange accent that you're hearing. Been in the country for 34 years, so I consider myself a Kiwi, but as soon as I open my mouth, I give myself away as being Canadian in my original origins. As Richard mentioned, we have an amazing panel today, actually, three extreme experts and brilliant speakers talking on the topic of enabling health through digital and data. And it's interesting, the three perspectives that we have, because they're coming from slightly different angles. And so I think we'll be triangulating on the topic. And the format that we've decided to use is we're going to ask each of them to speak for 5 minutes, just only as an opening remarks on what do they think are the three core areas of health, digital, and data that will impact on the future health system and the health insurance system in particular. After the three conversations of 5 minutes, we'll then be opening it up into a sort of a general interview / discussion panel. And we welcome you to put comments in the chat box or questions in the chat box if you want them to be asked of the panel as we go. So it'll hopefully be entertaining, but it'll also be informative. And I know it'll be outstanding quality given the speakers that we have on the panel today. So sit back, enjoy, and I'm not quite sure who's going first. Did we decide on an order? If not, I'm going to choose Will as the first up with the pretty slides. So Will, fire away. Thank you.
Hello, everybody. As Steve mentioned, I'm Dr. Will Reedy from Spark Health. I'm their Chief Executive. I thought I'd kind of share some thoughts to frame today's discussion. And the first few things I thought I'd share with you as an audience is the word ecosystem. And it's a word being used a lot in the New Zealand health system, particularly in the context of the reforms. And as many of you know, health is a complex system. There's about 6,500 providers that are funded in some shape or form, either from the Ministry of Health or health insurers or out of pocket for New Zealanders. And so with these 6,500 providers, it's a complex and adaptive system by definition. And when you look overseas to health systems that are ahead of us in terms of transforming how they deliver care, they've used data and digital as an enabler. And interestingly, for those of you who may have had the chance to read the Health Systems Review, effectively it said there's a lot of business or healthcare delivery challenges here in New Zealand, and data and digital are key enablers of that transformation. Further to that context, what we see overseas, and not so much in New Zealand, which I'll share in a moment, is that health systems overseas, including, I guess, the traditional health sector, but also life sciences, being health insurance, biotech, the pharmaceutical industries, and the medical devices industry, they're all becoming digital by design. And I'll talk a little bit about that in a moment. But effectively, those health systems overseas are using data and digital tools to transform their health systems. And typically what the focus is, and I guess that's one of the key opportunities with data and digital moving forward, is we start focusing on us as New Zealanders as the customer, and we become a people-centred type health system. So for me, the health system's an ecosystem, and data and digital, or digital health, has a role in creating an ecosystem to transform how we deliver services to New Zealanders. You hear the word digital health a few times today, or data and digital. For me, there's a lot of digital health technologies out there that could play a role in transforming our health and life sciences industry. In particular, you'll hear words like artificial intelligence, machine learning, big data, genomics, telehealth as examples of digital health technologies that have a real potential in New Zealand to transform how healthcare is delivered. But I will caveat that with, where does New Zealand sit on the world stage in terms of digital capability? And it's interesting to share with you, and I'm sure the panel will share some conversations later today, is that our digital maturity in healthcare delivery is actually pretty low. Our private and public hospitals are amongst the least digitised in the developed world. So if you think about data and digital as a key enabler of digital experiences for New Zealanders, you actually need to lift the digital maturity of our providers. So that was my first point, is think about the New Zealand health system and the life sciences industry as an ecosystem from a service delivery perspective and from a data and digital perspective. The next piece for me is around the difference between digital disruption and digital transformation. And again, in my terms, big buzzwords in New Zealand and the health sector at the moment. So transformation for me means that a healthcare provider realises they've got some business model challenges and they want to basically think about customer service, and potentially New Zealanders like you and I being the point of care for diagnostics, for treatment delivery, and for monitoring. And so that's where a number of healthcare providers today, and I think more in the future, will need to think about how they transform services. The other interesting area that's emerging in New Zealand at the moment is digital disruption. And there's a few new providers that are coming into New Zealand who basically are digital first in every clinical service they deliver. And it's going to be an interesting watch in the next 2 to 3 years as part of the reforms if we have some digital first healthcare service available to New Zealand, and whether they'll disrupt the existing health system of 6,500 providers and the associated health insurers. So my point there was, think about potential for transforming your businesses that you work in, or the potential for the healthcare system to transform, but also be aware of net new providers coming into New Zealand and disrupting with primarily digital plays. My third point, which is interesting to share, and again, New Zealand's a little bit behind, is what I call the convergence of health and life sciences globally. So again, the health sector as we know it, with the disability sector included, but also biotech, I should say, pharmaceutical industry, health insurance industry, and medical device industry, they're all starting to converge offshore with data and digital capabilities. Often that's in reaction to challenged business models or moving towards what I would call value-based care, which is another discussion point and opportunity with data and digital, is to get a real focus or a move away from what I would call utilisation-based healthcare or contracts here in New Zealand to true value-based care. The last thing I thought I'd share with you is we can get caught up in data and digital driving big change in New Zealand. But one of the real challenges for New Zealand and other health systems around the world is making sure that these digital investments actually have evidence in improving outcomes for the health system, particularly patients. So as we talk today about the opportunities around data and digital, my view is always, what's the evidence for the difference in care that a particular data or digital solution can make. So if we're thinking about artificial intelligence, what's the actual evidence that it makes a difference, say, in the radiology setting? So from my perspective, data and digital have some huge opportunities, but it's fundamentally around business strategy and business models, and thinking about data and digital as an enabler, and thinking about the people and process changes that are required around the technology. So that's my opening piece around thinking about data and digital, framing it from a business context, sharing some insights from overseas, and some of the potential opportunities around data and digital. So thank you.
Well, thank you, Will, for kicking us off and getting the conversation going. I mean, it's interesting, what comes to my mind when you're talking is data transformational, or is data a tool, is the first question that I would ask. And second question that comes to my mind that we'll get to talk about in the discussion is data as a business strategy. Well, business, it means that you have customers, whereas presumably patients are vulnerable and do not have a free market and are therefore vulnerable. So is data going to be used to prey upon the vulnerability of patients? And are we looking at big business using our patients as customers to promote their own business interests rather than to actually improve the health ecosystem? Possibly a risk of data. But we can expand on that conversation as we go. And it's really a bit of a segue into Karen, because I'm interested in her view sort of the health system overall and her international experience and some of her thoughts on the use of data and digital within a system framework. Karen, I'd be interested in your opening comments.
Kia ora koutou katoa. It's a pleasure to be here with all of you this afternoon. Thanks, Stephen. I was reflecting on what I thought were the top three kind of trends and drivers in data and digital health at the moment. We published a digital health trends white paper at the beginning of the year. And I think it's really important to think about what's the background and environment or ecosystem, as Will mentioned, that we're existing in at the moment. Incredibly, we've now entered our third year of COVID-19 response. And while many of us are starting to live lives more normally, and I've travelled from Tamaki Makaurau down to the Otatahi office of PwC this week, and it's wonderful to be back in the air again, COVID's not going away. And we're now starting to think about, and talk about coexisting with COVID for the next 10 years. And certainly it's not going to be the only pandemic of our generation ahead of us. With that ongoing response, we've now got a health system under extraordinary strain. We've got clinicians and staff across, community, primary and secondary care providers who are not feeling particularly resilient. And it's been a pretty hard 3 years on many people, and they're now being adversely affected by the COVID-19 pandemic by becoming unwell themselves now. Supply chain shortages that aren't getting any better. We've seen them in our local supermarkets, and we're starting to see them across the health system as well, with access to technology, tools and supplies, an increasingly short supply. We are experiencing a once in a generation health system reform with the emergence of Health New Zealand, the Māori Health Authority and the new Public Health Unit being established. And while that is ostensibly within the public health system, there will be no parts of our broader health ecosystem that is going to be untouched, including the private sector. We're doing quite a lot of work helping people establish locality models of care in primary and community care, and we need to all be thinking about how we're going to be involved in locality models. There's been an incredible shift during the COVID-19 pandemic to flexible and hybrid ways of working that are becoming deeply embedded into how we work, and that's affected our ways of accessing healthcare as well. I had a phone call GP checkup this week, and it was great to be able to speak to my GP in Auckland while I was in Christchurch, and I didn't need to go and see her in person to be able to access healthcare. So as we are all working from home more, that is going to change our overall response to how we deliver care. We identified 5 key digital health trends: equity, consumer participation, sustainability, workforce shortages, and omni-channel care. For today's kōrero, I want to speak to you about equity, and it's something that we're all responsible for. We know that the Crown has not always lived up to its responsibilities under Article 3 of Te Tiriti o Waitangi. And we need to address that within our own businesses and our own organisations and how we respond to equity. We need to make sure that all people have access to not only health care, but their own health information. And we need to be involving consumers in design, how we use data and how we collect data and use it for governance and provide data to community groups in iwi, how we involve people in iwi in co-designing our data and digital systems, and how we design our systems responsibly so that no one is left behind. And that includes the use and adoption of things like AI and machine learning. I've been saying for a long time that people expect to be able to consume their own health data in the same way that they're able to in other parts of their lives. For a long time, it was easier for me to go and get my mobile phone, go into the tea room in whatever ward I was working in, open a website, buy a pair of shoes, have a completely digital experience, put my phone away, and then go back into the wards and resume caring for people and doing my work as a midwife on the shift. And then the tools that I was using to be able to deliver care were so clunky, click heavy, really paper based. I would spend hours walking around hospitals looking for wheelchairs and equipment. You know, there was no way that I could just click on an app and go, where is the nearest wheelchair in our hospital? And use device tagging to be able to go and do that. You know, consumers need to have better experiences in our healthcare system than what they currently do. We are absolutely not meeting their expectations. You know, I got a text from my 79-year-old mum today going, how do I access my orthopaedic medical records from the hospital? And she's a nurse with a high degree of health literacy and is still needing help to try and navigate our health system. We need to do better for the people that we're caring for. And from a sustainability perspective, it's really interesting looking at procurement and some of the RFPs that are coming out of central government. They're increasingly building in ESG factors and sustainability measures into procurement. And we're going to see that increasingly through other sectors of the health system. As people are starting to think about social responsibility, supply chain, meeting Green Star building ratings, and how do they make sure that they're implementing sustainability measures and our response to climate change into data and digital procurement and adoption. So that's something that we're starting to see as quite an emerging trend. And something that we're going to all need to be responding to much more robustly than what we have done in the past. So those are some of my key insights. Back to you, Stephen.
Well, thank you, Karen. It's interesting, the healthcare sector, isn't it? I mean, they often say it's resistant to change. And I mean, a lot of the IT and data and digital transformations have occurred in many other sectors. But for health, it does seem to be recalcitrant to trying to be nudged along. I remember the New Zealand Health Survey suggested that 17% of patients do not access healthcare due to cost concerns or a variety of reasons. And so you're right, data and digital represents a great opportunity to hopefully achieve better equity, but of course it also is at a risk, because if your IT literacy is less in certain populations, you may actually increase inequity, and it's something that we can discuss about in the panel afterwards. But it was really a nice opportunity to introduce Reza then, who has been, Reza, hopefully you'll introduce yourself as well, but Reza has been running a virtual GP or a virtual healthcare telehealth service, and maybe you want to talk a little bit about access and equity and other issues, please, Reza.
Absolutely, Stephen. Thank you. Kia ora tātou, ko kei tū te maunga, ko Reza te awa, e noho ona ao ki Ponsonby, ko Jarral toku whānau, ko Reza toku ingoa. Thank you so much for that kind introduction, Stephen, and good afternoon, everyone. It's an absolute privilege and a pleasure to be having this kōrero with such an amazing panel, really. Look, for me, data and digital have tremendous potential to firstly transform the patient experience, to be used as a weapon to tackle the challenges that we're facing in the sector today. but also, as quite rightly pointed out by Karen, to address healthcare inequity and those really difficult intersectional social determinants of health that Stephen touched on as well. Firstly, transforming the patient experience. I mean, we can all see the consumer trends. Everyone wants on-demand digital services now. And if they can't get it now, they're going to look elsewhere. You just have to look at YouTube, Uber, Amazon Prime, and you can see the speed of consumption of services. And I don't think healthcare is going to escape that trend for much longer at all. In the midst of the pandemic across 2020, we saw up to 1 billion telehealth consultations. And while levels have since stabilized, we're seeing maturation at 38 times higher than pre-pandemic. So telehealth also is part of that trend. And I think that comes in the context of congruent technology that's been around for a long, long time, but has only just been adopted in the sector and by consumers in the context of healthcare. And they include wearables, the ubiquity of smartphones, IoT, and increased connectivity. And when I was thinking about insurers and the context of what you might be experiencing, I was thinking that really you want to be more relevant to your members on a day-to-day capacity and engage them proactively in their well-being in a preventative sense, not just by being the ambulance at the bottom of the cliff. So digital and data for you could be part of engaging your members as part of their solution in health, not just a passenger, and making health and well-being more relevant to their daily lives through their insurance program. Secondly, using data and digital to tackle the challenges that we're facing today. I think we all know what challenges we're facing, including the cost of healthcare, sustainability of our system, and workforce issues that Karen rightly touched on in her white paper as well. Part of that will involve shifting the point of care from expensive hospitals and shiny buildings into the community, not necessarily GP surgeries, but into homes. And I think empowering consumers with the tools that they need to be proactive and engaged is an integral part of data and digital. From a workforce point of view, I've got a lived experience with CareHQ. What we do is provide remote consultations across New Zealand using GPs. And what I've seen are doctors who are new parents looking to pick up a 2-hour shift when it's convenient for them, or retirees looking to tone down their work demands and balance work and life. And we've allowed these doctors to actually work at shifts that are convenient for them from anywhere in the world, as long as they remain legally compliant. And that's been a whole shift in paradigm for me as a GP who traditionally worked in brick and mortar on shifts that were given to me by my practice manager. From the insurance space, I think data offers great potential for you to rationalize the cost of your spending. And you can actually negotiate with better data on behalf of your customers to really identify that outlier behavior for costs and where you're spending a bit too much. And by doing that, you can actually minimize your premiums and make your products hopefully more affordable for more New Zealanders. And affordability and accessibility leads me on to my last point, which is addressing inequity, ESG, and how do we tackle corporate social responsibility in the health sector with data and digital? Well, look, we've actively engaged in digital equity from the beginning of CareHQ because we understood that if you deploy a new technology or service, it will simply manifest through existing structures of inequity in society. And if you don't actively counteract that, then you will be complicit and widen that disparity even further. So that's part of the work we did with the Ministry on the Digital Enablement Programme. And we've got some really exciting data to publish at GP22 this July. I think data can also help us actually address those discrepancies in health and outcomes and confront the really uneasy truths in society. So data and digital actually has a potential to unveil the problem and measure it, understand it, so we can get a baseline and launch our interventions based on that. And looking to the future with reforms, when we look at localities and potentially a healthcare data ecosystem like HIRA, we might be able to get interconnected services at a local level that help us address not just the healthcare needs of those populations, but actually the social determinants of health. Because actually, increasingly, we understand that 80% of health outcomes are determined by your education, your housing, your access to food, and social connections, not necessarily whether your GP or specialist prescribed you an aspirin. So tackling those social determinants of health in collaboration across these localities, it offers tremendous potential for Kiwis. So in summary, data and digital has awesome potential to transform the patient experience, become a key weapon to tackle the challenges facing our sector today, and also to address inequity. But for me, I feel like we're at quite a critical juncture with this reform, but also on the backdrop of what many people are calling the fourth industrial revolution, where we could deliver on this promise of data and digital, or if we're complacent, we could inadvertently widen existing gaps of inequity and contribute to escalating healthcare costs. But what will determine the direction of this field will be predominantly, I believe, our collaboration across sector and across divides in New Zealand, and critically, our involvement of users in co-designing alongside us.
Well, thank you, Reza. Maybe if I can ask the panel members then to turn on their cameras at this point, and we'll begin a conversation. I should have mentioned, by the way, that I'm the Chief Medical Officer at Southern Cross Health Insurance as well. That's why I'm chairing this session today. Will, can I just take up something Reza said and how it links to your talk as well? So 1 billion telehealth consultations. And you mentioned how we are a small player on the world market. And so internationally, do you think that the future is that New Zealand population may be seen as a potential customer market for big business? Do you think we'll see Google telehealth delivered from the States to New Zealanders, etc.? Is that where we're moving for the delivery of telehealth in an international manner?
It's a really good question, Stephen. I think from my perspective at Spark Health, we work with the Amazons, the Microsofts, the Googles and the Apples of the world. And many of you may know that they have dedicated health and life sciences verticals. Is probably the easy description of what they do. And generally speaking, they focus on the North American market and can't translate a lot of their capability into what I would call socialised medical systems or health systems like New Zealand and Australia. So I think they may be a technology enabler, but the actual service delivery piece needs to be local. If you think about the needs of New Zealanders, there may be some services that, if you like, we outsource from New Zealand. And there are some examples of that. If I think about radiology services in terms of having Australian radiologists reporting on imaging as an example in the telehealth context. But I certainly think for now, given where we are, that the global players won't come into New Zealand. I think there's more of a risk around clinical services providers that leverage technology platforms that may come into New Zealand is probably the bigger risk. The other interesting thing to share with you, which for those of us who've been in health for a long time who may be listening to this, is I think a lot of the digital health providers or the global players have hoped that this was a short-term game. In terms of how you transform healthcare, and the actual answer to that is it's not. And fundamentally, from my perspective as a clinician, it's around that provider-patient trust type piece. It's a slightly different paradigm to what you see in other industries. The only caveat I have to that in terms of, and I'll be interested with it from the other panel members, is I believe if we solve digital equity and provide the right digital customer experiences, we're probably going to unearth a whole lot of unmet need in New Zealand. So I personally believe as we offer more services digitally and become more accessible, that actually there's a whole lot of unmet need out there. And I'll characterise it in Kiwi styles, which is I just can't be bothered to book the GP because I've got to wait 2 weeks. But if I had capacity digitally, I'd go and do it. I think there's a hell of a lot of that happens from a customer demand perspective in New Zealand. And so if that unmet need doesn't get addressed with workforce or smart digital services and or digital health workforce, I think that opens us up to a customer-focused industry where New Zealanders potentially look offshore for credible, approved clinical services. I think is potentially something that could happen.
Sure, and I suppose the risk there as well is health doesn't follow the laws of demand and supply and demand. And so, I mean, as we see in the US, the more doctors you have, the more healthcare expenses you actually increase without increasing healthcare benefits. So you can also increase the worried well, not just meeting unmet demand. But Reza, can I just follow up? You do a lot of telehealth consultations. Can I just ask really a two-part question? One, what is patient satisfaction with telehealth? And the second dangerous part to that question is, if telehealth can be provided just by a series of questions over a video link, then isn't it ripe for AI? And what percentage of doctor-patient interactions do you think could be replaced by a bot or an AI system in which you answer a series of questions and your diagnosis comes out just as well from technology rather than a doctor?
Stephen, I didn't think AI would be raised this early in the conversation as replacing doctors, but here we go. Look, I just want to talk a bit about what Will spoke about first, because it is actually quite important, and it's really important to why I joined CareHQ in the first place. So Will mentioned in his opening talk that digital-only providers can disrupt, and I absolutely agree. Digital-first providers can disrupt, and disruption in healthcare, it doesn't have the same connotation it has in other sectors. It can be deeply harming for long-standing patient-doctor relationships. One of the reasons I even joined CareHQ was because I came from Northwest London, where Babylon launched. So Babylon, for those of you who aren't aware, is a digital-first enrolling GP service that does a symptom checker with pseudo AI before you get to see a doctor. Now, what Babylon did in 2016 was to launch a very predatory advertising campaign to digitally enroll young, healthy, technologically savvy Londoners to a phantom practice about 100 meters from my home that I've actually worked in. Now, the disruption that was caused almost bankrupted their local PHO overnight, as they enrolled 50,000 patients, and the capitation for those patients followed them. But the knock-on effect for the local surgeries was that they had to shut their doors, because it was those young patients that were subsidizing the high needs patients. And we're in a similar situation in New Zealand. Babylon got in trouble with advertising standards, CQC, false claims, and they've gone on to be publicly listed for $4 billion in the US. And Babylon did look at New Zealand as a potential market, but we just weren't big enough to attract them. But what I did see were adverts that were basically copycats of Babylon, using similar imagery and similar words. And that caused me to feel quite worried, because what was going to happen in my home turf in Hammersmith was about to happen in my new home, Auckland. And that's why I joined CareHQ, so that I could offer a similar service, but without that element of disruption. And the critical part of that is that we offer overflow services in partnership with GPs. We also allow GPs who are quiet to work on the CareHQ platform. So we redistribute demand and supply actively with primary care, but we don't enroll and we don't charge clawbacks, because that's a critical part of the capitation model that's vulnerable to disruption for digital first. So I just wanted to get that off my chest. I can see a few nods, so I think we're all aware of what's being spoken about here.
And if I could just, so your guess of what percentage of patients' needs can be met through telehealth, if you had to pick a number out of the air? So
highly contextual, Stephen. International benchmarks for primary care, probably 50% of walk-ins. What we're finding from our experience is about 70 to 80% of our patients are entirely concluded online. And what that tells us is that Kiwis are pretty good at self-triaging, or our current demographic using our service are better than we expected at self-triaging. Because I think paternalistically, sometimes doctors think, they won't know how to use it. They'll use it when they've got chest pain or they're actively bleeding. But actually, Kiwis are smarter than you think. And that figure doesn't change when you go to high needs populations, Maori, Pacifica, High Quintile. They actually use it in a similar way. So I think digital literacy is something we need to work on, but perhaps it's not as bad as we thought when we started this work.
And that's a good point, Karen. Reza mentioned about regulation, and I think you talked about patient-centric care, and you can empower patients with information using data. But Is there a risk? I mean, if you have, for example, I've had patients in the last 3 months, actually, who I ordered a CT scan for, and their result came back on their patient portal that they saw they probably had a cancer that they read on their portal, sitting at home at 8 o'clock at night with no health intelligence or ability to chat to me about the relative risks, etc. So can information, is it always good that the patient owns their information, or are there risks in the patient owning information? Does it need to be moderated? And what about the regulation about information? Who owns it and who should own it?
That's a fantastic question, Stephen. I have a very personal opinion that we actually do own our own health data and information. It is information about us. And that health providers are responsible kaitiaki or guardians of information, but no health provider owns information about me. Your question, so it was a two-parter, and your question about, is it responsible of us for people to be able to access their own information and to be able to potentially open something up on a portal to find that you've got cancer. It reminds me of probably about 20 years ago, my sister had a scan of her brain and was given a letter to take to her doctor, and the doctor would then open the letter and read the letter and tell my sister what was wrong with her. But she opened it up herself while she was in the car and discovered that she had a brain tumour. And she had some time to process that information and what it meant for her being 33 weeks pregnant at the time. And when she got to the doctor's surgery, she had been through some of the shock and grief of having that diagnosis. One of the other things that, as a midwife, when I first started working, was reading research that said that people that had access to their own health information had fewer interventions during childbirth. And it changed by giving women access to their own health records as a clinician. It changed how I wrote about people and what I would say. So everything I would write would be in a very consumer-centric way and written in ways that they would be able to understand. I used less abbreviations and less jargon in my documentation because I needed, the woman in their whānau to be able to read what it was that I was writing without having to have a clinician at their elbow interpreting it for them. And we can document in ways that people are able to understand. I think that the need for us to be with people when they receive diagnoses is quite paternalistic. And I think it's time for us to shift that perception. I think we deal with pretty amazing human beings as clinicians when we have the privilege of caring for them. And I think that we can respect their ability to be able to have adverse diagnoses without us being there to hold their hand.
Yeah, I appreciate that. And well, Reza was talking about, insurance companies, for example, can use data to hopefully, if they use it wisely, they can reduce some of their premiums. But talking about ownership, is it right that insurance companies may or may not get involved in well-being? Insurance companies may know how many steps you take, what your BMI is, what your blood pressure is, etc. Are the insurance companies the right people to be involved in data and well-being?
I'm going to start with extending on from what Karen said, and I'll put a hat on, then I'll answer that question. So when I came home from being offshore transforming health systems about 5 years ago, I had the pleasure of being the inaugural chair of HERA. HERA is a national health information platform that we're looking to try and put into New Zealand for about the third time. And the context for that was, did we just focus on sharing information between providers? So when you went from your GP to see a hospital specialist to get an operation back to your GP, or your physio if you had a total knee joint replacement, do we just focus on sharing information through those disparate providers who are all on different systems, which is pretty much what most of the rest of the world had done who are ahead of us? Or did we go a step further and actually focus on customer experience? And ultimately what we did over about 6 months, and I'll keep it short, was we went and asked New Zealanders, did they want a digital experience to maintain their health and wellness? And the answer was both hands up. like, hell yeah, pretty much, right? And we went through a whole lot of use cases around diabetes, aged care, mental health, the worried well, you name it, we went through it. We asked New Zealanders to talk about those customer journeys, and they could poke every hole you can imagine in the fragmented health system. And then we asked them what it could look like with digital tools, and they were able to look at parallel industry like banking and go, yep, we can have this experience digitally. Then you asked them what information was important to them, and they could all answer that. And I guess the key message here is Kiwis are pretty smart in terms of the conversation we had earlier. And they could say, look, I want a shared care plan if I've got an illness. I want to have my own preferences around digital tooling, voice, video conferencing, texting, email, secure messaging, app alerts, whatever it is. They are able to articulate that. They also said they wanted to have access to the demographic information and what services they are entitled to across the health sector and how much money they had available to spend on those services. So this is 5 years ago, like 2017, pre-COVID, not driven by COVID, just asking New Zealanders what they wanted. So my view of the world out of that is New Zealanders want this experience. The other thing that emerged from that, and I'll give an analogy, we're doing a pretty good job of that today. My dad's 74, my mum's 73. My mum uses a smartphone. My dad uses a Nokia 3310. For those of you on this, it's the old texting phone that runs only on 3G. And so in reality, if we go to digital healthcare, my mum will be the care navigator, the caregiver, whatever words you want to use. But my dad will by proxy say, hey, can you please look after my health like you have been in the analog world for a long time, and can we translate that to digital? So my view of the world is New Zealanders are up for this, and we've got to involve them in the co-design. And when you ask questions about their data, New Zealand's Privacy Act doesn't support consumer-entered data. It supports provider-entered data about you and I. So there's a big change that's needed there. But if you actually ask New Zealanders involved in the co-design of the service, we'll hear some interesting things around secondary use of their data, probably anonymised in the health insurance context. But that's what I think is likely to happen if you actually ask the customer about the value. Now, in some parts of the US right now, I'm not advocating it for New Zealand, but there's some interesting business models coming back to that convergence of health and lives and health insurance, which is you can sell your data, share that data with a health insurer in an anonymised way in order to receive subsidised services. All right. And so that's a customer choice that you're empowering them to make. I'm not suggesting we're going to do that in New Zealand, but you do think a bit differently with these different business models. So I'm not saying it's off the table in New Zealand, but it's something we need to think about.
And Reza, we'll use the word value in that sentence, or one of the sentences. And to an insurance company, we're regularly talking about value-based healthcare. Value is defined as outcomes that matter to patients divided by cost. But of course, doesn't it become difficult to define what is a quality outcome? I mean, Will has just said patients are pretty smart. They know what they want. You just ask them. But if I ask 5 patients who need a colonoscopy, do you want to go to the nicest colonoscopist? Do you want to go to the cheapest colonoscopist, the one with the shortest waiting time, or the one with the highest detection rate? You might get 4 different answers if you ask the question. That's number one. And secondly, what is best for an individual patient may not be best for a group of patients. For example, an individual patient might say, oh gosh, yes, I want to be fully tested with a complete CT scan head to toe every single year. But the group of patients would say that's going to pick up a lot of false positives to the population. That's going to be extremely expensive. So value has to be defined differently between an individual and a population, and the definition of value is an individualistic thing to a patient. Is there a danger in corporations monetizing this word value without truly understanding what it means?
Yeah, look, Stephen, I'm not entirely sure I understand what it means to be. No, I'm joking. Look, I think what you're posing are quite high-level philosophical questions around sensitivity, specificity, long-term outcomes, and the general public don't really have that type of awareness accessible to them. So I think it's really important that as we start to open up digital ecosystems, which I think are a fantastic idea, Will, in premise. I love the concept of it, and allow patients to be more mobile with their data and their choices, which ultimately is the future, whether you want it or not. We do have to have very strict legislative guidance around how they interact with providers to safeguard patients, and also to ensure that we act in an ethical and consistent way across the sector. Particularly areas like genetic testing with algorithms. How do we ensure that an insurance company doesn't charge you more because you have a degenerative disease only diagnosable from your genotype? I mean, we've all seen the film Gattaca with Uma Thurman, which takes that to the nth degree. How could you predict someone's phenotype from their genotype and therefore make decisions about their life for them based on when they're born? So I think there's a lot of uncertainty here. I'm definitely open to the idea of data ecosystems, but I think what we could take inspiration from is the Goldacre report, which came out last month, about large data sharing platforms in the NHS and how you can truly anonymize that data, make it fully transparent and private, and share it, but in a way that allows patients individual control of their own data. And part of that will be digital literacy training inherently. With CareHQ, we've gone in with the service, but we've also gone in with digital literacy aids, because you can't go in with the technology alone.
Karen, is there a danger, though? I mean, can you have too much information? I remember reading an article about the Apple Watch that will detect if your heart rate is irregular for more than 30 seconds. And turns out 30 to 40% of the population will have that, but we don't know what that means. And so we're starting to get more data than we can use and don't know what it, genetic testing was a nice example that Reza used. Is there a role for regulation, or is there a role for doctors to moderate this, or doctors just becoming paternalistic again and thinking, I know best, and are trying to resist the data? Where does the regulator sit in that, and is there a danger of too much?
So I think there's a difference between data, information, and knowledge. And if you think about kind of your data, information, knowledge continuum, we need a lot of data to create information. And then the insights from that is what gives us knowledge, and knowledge gives us power and control to make better decisions around our own health and well-being. Another way of thinking about data is the soil in which that we need to be able to grow AI and machine learning. The more soil, the more data you have, the richer the environment is for these tools to be able to flourish and to become more intelligent and to be able to learn. So I don't think there is such a thing as too much data. What we need to get better at doing is contextualizing that data into information and insights that people can understand, and then to be able to action through knowledge. So that would be that's something that I don't think we're very good at doing, and we see that in our own business as well. We're great at getting reports where there's a whole lot of data, and people will have some lovely graphs or some pivot tables off a spreadsheet that they've created for a board meeting. But you need to be able to contextualise that data to be able to give you the insights to be able to make decisions in all parts of the business.
But arguably, if a business makes a decision, this is my very simplistic doctor view of the world, you lose a bit of money. But if you make a wrong decision in health, potentially it can cause fatal outcomes. At the moment, we regulate doctors, but we don't regulate technology. So if your phone tries to diagnose your skin cancer and gets it wrong, are there sufficient safeguards in place? Who would you sue? What would you do about it? Can you call ACC and call it a treatment injury because your phone missed your diagnosis? Is there a role of the regulator, Will, somewhere in here? Has the technology and the data got ahead of the knowledge, as Karen nicely describes it, and also ahead of the regulation? And are we in a dangerous point on the wave?
I come at this from a few different points of view, and again, it's a little bit to do with our maturity in New Zealand, and I'll welcome the other panel members. So for me, we talk about digital health transformation, and what that really means is any piece of tech that can be applied to health. But the context for what I'm about to say is we're in danger of choosing all these digital technologies and getting an app for that actually doesn't make a difference in terms of evidence. So offshore, what they actually do is they get the research behind these digital health tools, and they call it digital medicine once you've got the evidence base. So a lot of the AI machine learning type stuff, even some of the basic telehealth type pieces, the Internet of Medical Things, which is just a fancy way of saying medical devices at home, they're all like FDA approved or certified. They've got data sharing standards, and any kind of clinical decision making has gone through an evidence base. And the best way I can articulate that to probably this group is I'm the Chief Medical Officer of Spark, our 5,500 staff, and we've got mental health and wellbeing issues like most of New Zealand. I've had to look at 7 mental health apps to recommend as a tool for our staff, and none of them have any evidence that they make a difference to anxiety, depression, or suicidal ideation. So the danger is you choose an app, we offer it to our 5,000 staff, and actually it doesn't make a difference. So for me, it's a maturity thing for New Zealand, but it's done offshore. And there's some things we can adopt offshore into New Zealand. And I've just been in an Internet of Medical Things session with the universities, and there's definitely a role for academic research to look at these digital health technologies and making sure they're safe and evidence-based to be recommended, certified, whatever words we want to use from a regulatory perspective. I also believe, I'm going to call them Health New Zealand right now, have a big role to play. So they're getting into the Internet of Medical Things or medical devices and setting standards. They're doing that with data sharing. So we'll see more and more of that over time as we mature. So absolutely the regulatory obligation, and it's done offshore. It's just a maturity thing in New Zealand from my perspective.
And I'm just going to ask you all to wrap up with a 60-second, your final word, but I'll make a little comment about that. I mean, the risk is, though, that because there's a timing issue and the regulation is coming last and the knowledge and evidence is coming last, at the moment you have businesses sprouting up because of the money that can be made. And so you have the Skin Institute, the Back Institute, the Heart Institute, and so on. You have advertisements for varicose veins on the radio today, for example. So you have businesses sprouting off to try and make money from health issues, and technology is well ahead of the curve in all of that. Reza, I'll just ask, there's literally 3 minutes left, so you each get 60 seconds to make it, from your view of the world, enabling data and digital to the insurance and the financial industry, what is going to be the greatest challenge in the next 5 years?
I think making sense of all that data and navigating it in co-design with your members. So being more relevant to your members and their day-to-day life, and part of their preventative care regime is going to be critical, so that you can enable your users to be part of their solution, not just a passenger. Some of the solutions you might want to look at will include Orca or Cindy that look at those types of digital therapeutics and assess them with validated metrics. But again, this is an early era of digital therapeutics. Let's see what comes in the next 5 to 10 years.
Thank you, Reza. Karen?
I think that working with your members and with the people that are consuming your services to make sure that you are adapting and transforming along with the needs of your customer base, so that you stay relevant. Consumers know what it is that they want, and if they're not getting their needs met, then they will go and look for another provider. Doesn't matter if it's in digital health or in any aspect of their lives as consumers. And increasingly, people are taking control back into their own hands and making really considered decisions about what they want from the services that they consume.
I would challenge you on that one slightly to say, do patients always know what they want? And sometimes our customers always right, especially in health. Customers may want lots of tests done, which isn't in their best interest. And so the insurance company has that difficulty of meeting their customer demands versus doing the right thing by medicine. Really ask yourself as an insurance company, are you a finance company that is selling health insurance, or are you part of the ecosystem of health delivery? But anyway, sorry, Will, your final wrap-up comment, please.
I think the greatest challenge is getting a national digital health ecosystem. I think we talk about data, information and knowledge, but certainly in secondary care, I use a pen and paper every Friday. So there's an element of digitising all the providers to a level around their processes and getting the data. And certainly we should be offering New Zealanders the opportunity to collect their data digitally as well, to get that kind of underlying data from New Zealanders and from all the providers is the greatest challenge. In the next 5 years, I think you gave us a time box of 2027. I think that's the greatest challenge at the moment.
Well, I know this is being recorded, but we won't quote you on this, but the National IT Health Record was live and well in 2011. They announced it was going to be done by 2015. It's now 2022. Do I have a prediction from all of you? Will we have a single electronic health record in New Zealand? And if so, when? One word answer, Will?
Are we talking a year?
Yep. Will we, and when will we?
We will have an interoperable national record across multiple systems, not one single one, is what we're going for under HERA. And I think there's a good chance of having it done in what I call the long term, your 2027 prediction. That's what I think.
Wow. Thank you for that. Well, thank you very much, panel members, and thank you for the audience. You've been extremely quiet. I've been watching the chat. Nothing has come through. I hope we've at least addressed some of your questions, or hopefully we've even stimulated a few new questions for you. So thank you for your attendance this afternoon, and I'll hand you back to Richard. Thank you.
Kia ora. Thank you, Stephen. Thank you, panel. Wow, what an amazing trip through some of the big issues, big, medium, and small. I think provocative, highly provocative would be my take on the tone of the conversation around the future of health and digital. And we've got a fantastic audience, obviously, been listening and I think digesting. So provocative and digesting is how I'd probably sum up the nature of the discussion, Dr. Stephen. I think, look, for me, there's a running thread. And it's not just in the health sector, but certainly in the life insurance sector, the advice sector, the broader wealth sector as well. And that's, COVID has been difficult in many ways, but it's also been a gift in many other ways in terms of accelerating a lot of the thinking around digitizing, about engagement. The question that you asked around, well, how much is enough and who owns the data, I think is a big one. I think the issue of regulatory perimeters and is the sector moving much faster than regulators will move, I think is a big question, not only locally but globally. So I think we've set out to challenge people and their thinking, and I think the panel of Reza, Karen, Will, amazingly well facilitated by Dr. Stephen. I just want to thank you on behalf of all the listeners, all the people in the room. Stephen is right. We have recorded this. This will be up on our website. We will share it through social channels and in a separate text conversation with Troy, keen to perhaps reprise some of the areas of focus at our September conference. So, folks, without further ado, kia ora, a big thank you to everyone for your participation, sharing your insights and your knowledge, and to those of you on the phone for streaming in, watching, and being provoked and challenged. And with that, an awesome afternoon. There are a number of other things coming up for those who wish. We have Nicola Willis in a similar conversation, fireside chat next week. If you want to come to Queenstown, we're going to have a discussion in the financial advice sector. We have the Deputy Governor of the Reserve Bank, Christian Hawkesby, joining us. Lots of outlook on economics, and of course our flagship event, which I think we can be confident that we're going to be in person for the first time in 3 years in September in Auckland. And with that, folks, have a great afternoon. Thank you again to the panel. Thanks for sharing your wisdom. Kia ora, all the best. Bye for now.